sparing your time to be with us today. I know one of the panelists actually, we had to, in fact, two of them have only been asked this morning to be with us because of commitments that have forced two others to pull out. So we do appreciate you being here with us. So before we start and before I bring our panelists in front, I'll just talk a little bit about why we're here. So this session is about us discussing the changes that are happening in public health in terms of AI adoption, but also telehealth provision of public health services. We know that AI solutions are actually developing at a fast rate every day. Every day you hear about a new solution, whether that can be in China, it can be in the UK, in Singapore, but also even here on the continent. We are doing our best to come up with our own solutions. What is not happening is for public health adoption of these services to move at the same pace that these changes are happening. But the other thing as well is that a lot of the solutions that are happening are not based on our own data. They are based on data from elsewhere, and this has been the theme so far of this festival, where we've heard time and time again that we need to do a little bit more about generating the data that we are actually using to train the models for the solutions that we are developing. So one of the things that we need to be considering is when we are coming up with these solutions, we need, as people have spoken this morning even, and also yesterday, about the patient who is having to walk 4 miles to go and access services. But also we need to be thinking around the accessibility of these services. If they're let's say, wearable solutions, wearable products, how many people are going to access this? So we need to be coming up with solutions that are also inclusive, and I hope that our panelists are going to cover some of that in the responses to some of the questions that I'll be putting forward to them. And then there will be also an opportunity for you to ask questions of your own. So without further ado, and please, as has been the tradition so far, please, as I call our panelists to the stage, please give them a round of applause and don't stop, as has been, I think, the custom now, until everyone has sat down. So I'll start with Dr. Charles Kimpolo. If you can take the seat on the furthest left. The questions and also give an opportunity to our audience. If you can just give a few remarks in terms of the role that you play in your organization and where it's applicable, whether you have actually used the services I've described, and if your organization is working towards those. Bearing in mind, I will also be asking some questions. So I will start from my left, going furthest left. So over to you, Violet.
Thank you very much for that bit. So my name is Violet Wandaho Njuguna. I am not a doctor, but hopefully I'm a doctor by association. So I'm a product manager. I belong to a team called Technology for Development, and as the name suggests, we basically use human-centered design to essentially immerse ourselves in the problems and see how we can actually be able to now leverage technology. So we identify, develop, and scale innovative solutions, and I specifically handle the health portfolio. And then to your question in terms of how we've been able to leverage or what we're planning to do in as far as AI is concerned, I think if you actually have a chance to visit our booth, you'll see we actually have a partnership with, we're working on a partnership with Signverse. So basically it does what that lovely lady does in terms of translating sign language, so that we want to make sure that no one is left behind, and we want to make sure that our solutions are innovative and they're inclusive. So one way is to leverage AI to be able to translate that for you.
And that 9 to 11 million young people entering the workforce are competing with only 3 million formally, including the health sector, or agriculture that is making our commitment sustain. Why do we have that situation? Because of the space mismatch between what we get the degrees and what the market needs. Even if we can get credibility for the job that we have a deficit of around 8 million jobs that we need every year in Africa for us to absorb the country. We need partnership. I think the fact that people can actually call me with UK numbers from Rwanda, UK numbers, okay, I want to report and come and support. So in Rwanda, where I've spent actually my past 9 to 10 years, I've seen serious programs, intentional vision and leadership to make things happen. I've seen it. I'm not speaking on behalf of Rwanda as a government, but as a key stakeholder in that country, I've seen that. One thing that we are here with the Future of Science Ambassador is because the Youth Foundation actually provided us with some camp to put the youth in front of what we call youth-led innovation for sustainable development. Before coming here with my colleague, Jean, we just launched a call for SDG innovation in the health sector for 2026. Guess what? From 6 to 8 slaughter around, we have 800 young people, including Kenya, that submitted well-shaped, innovative solutions around SDG. Just to tell you, it's not the skills that are missing. We learn it from the other side. It's really the leadership opportunity that we need to provide young people, because the future depends on them. So if you talk about the health sector system, the hospital that I was born, and the hospital that my kids are born, are completely different system that we need to acknowledge that the world has changed and the world will continue to change. Now when it comes to AI, because I'm sitting here at AI, I've been pleased to participate in a lot of international conferences, and I'm very frustrated sometimes because the narrative sometimes is already said. 4 things about AI, maybe I want to unpack it. The AI tools that we're enjoying are built around 4 pillars. The first one is data. The data that the model of AI has been trained, I will shock you, they are not in Swahili. They are in English and Mandarin. Okay. So data is very important. The second pillar that AI model are built is the compute power. I don't think that our young people with our laptop can run the model that AI requires in terms of the compute power. The third pillar that is very important is the talent. I'm pleased that Dr. Linet is here saying computer science, social scientist. We're moving away from the issues that we had in the past in terms of building capacity in computer science, which is like programming. Now we talk about AI engineering. We're forgetting that the talent might be different. The third one, which made me come to the panel, is really the enabling environment. To have Theo come with this platform for us to say what works, what is not working, for us to share. But I will end by saying that it's really partnership-driven type of program that I'm more interested in. Thank you very much for inviting me.
Yeah, thank you very much for that, Charles. And I think you picked on something very important there in terms of government will. political will to actually, for these innovations to take shape. And again, as we discuss what works, what doesn't, I'm sure you will be going back to that. As someone who lives in Rwanda, I can actually attest to what you've said, that there is innovation, and I've lived there for 5 years now. I know what it was like 5 years ago to what it's like now. And actually, let's have a commercial break. I started by introducing everyone else. So if this was a TV program, we would go for a break, have a commercial. So now I'll just introduce myself. I hadn't done that. My name is Theodore Joloza. I work for the Office for National Statistics in the UK, but we have an international division in the organization that partners with a number of countries, and Kenya is one of them. Rwanda is also one of them. So I lead these two partnerships. So although I'm based in Rwanda, I'm no stranger to Nairobi or Real Towers, where the Kenya National Bureau of Statistics sit. So that's who I am. But yeah, I just wanted to underscore the point that there's been quite a lot of change in Rwanda, and I dare say actually here in Kenya as well. So I started working with KNBS a bit late, but the innovation that has taken place there, bringing in efficiencies, is quite great. So I just want to say, where there's a political will, there is a way, especially where innovation in public health is concerned. I want to break with tradition, and based on maybe the introductions that our distinguished panelists have made, if anyone has a burning question, before we go to the questions I have for them, please feel free to put your hand up and we'll get a mic to you.
Thank you. My name is Maningwira. I'm from Malawi, working with Look International, and I also work with the Public Health Institute of Malawi. My question goes to Dr. Charles. He introduces a very good component in terms of the AI. The data models, the computer, that one, we, as the youth, we can try to navigate them. But now this to do with governance. I find that in the public sector, it's easy for the NGOs to adopt AI initiatives than the government sectors. So what is the way forward, especially moving forward, knowing that AI is here to stay? What is the best way to navigate and enable that the government also embrace the AI initiative, especially in the health sectors? Thank you.
Very difficult question, but they broke with tradition, so you're shooting at us. Maybe Lynette will actually support me. So that's why I say the fourth pillar. Remember, data, compute, talent, but I say enabling environment. And the enabling environment speaks of governance, policies, and partnership, innovation, and all those resources. I try not to blame the government. Government, this is people who lead us. They did not predict or plan for AI to come and disrupt the way we are doing. It's an innovation in the tech side, but they need to not only catch up, but deal with it. When you have innovation, usually the question that you ask is, who will regulate the innovation? Who is the expert that you expect at that time in the government that the Director General of the NSA becomes like an expert in AI and then regulate? So regulation should come from expertise and things like that. So we need to face it. Should we wait for the regulation to be in place before we enable innovation? Is wrong. Some people say innovation should drive regulation, other people say regulation should actually guide innovation. I don't have a correct answer, but I think the government has a mandate to regulate, because otherwise AI is not only on the good side. AI is doing some kind of very crazy stuff also on the dark side. So you need to have an ethical, more responsible AI. It is true that government might not adopt it at the pace of private sector, as you mentioned. The NGO, they're non-government, right? They're working on the layer that they have more flexibility in actually driving that. I would say it's through partnership. So if you remember in my introduction, I led the AI Hub for Sustainable Development, which is UNDP Global strategy. I had an opportunity to have like workshop around 9 countries. When I did that report, I cannot share it with you, in terms of government readiness in AI, let's face it, many governments are not there. Because the indicator that we have for us to push AI, come on, it's computer science, it's computer literacy, it's the talent. So there's a lot of gap. But I don't think that government can say no, because AI has the potential also to drive innovation. So I understand your frustration, but I think I would give the government space, time, flexibility, to develop a capacity, but also partner with institutions. I think Lynette institution, maybe Lynette is maybe an expert in one, to have a way of trying to regulate that will not impact innovation. Okay? Because when you put data in those kind of platforms, we don't even know who's doing that. There's security around that, the government level. So your question, NGO can adapt AI easily. Government organizations are not there. It's not because they choose not to go. It's just that they need to be super careful. And I think it's their responsibility as a country to ensure that they have policy in place to regulate that. Now, when? I don't know. We need to start somewhere. So I don't know if that answers your question as a young person. In Kenya is different. I think Kenya, you're doing a lot of great stuff. Rwanda is also different. I'm going to share more about what I've seen in Rwanda. But globally, it's all about asking the question, is our government in our country ready? Do we have an AI strategy that guides things? If you don't have it, what do you do in the meantime? I don't think that government will say, stop doing your innovation, especially challenge. Is that confusing or is it helpful? Okay, thank you.
Let me just add, governments generally around the world are risk-based. They think about the risk before they think about the reward. I always say, within government, it's riskier to do than not to do. If you do and it doesn't work, you're on the chopping board. And if you don't do and it doesn't work, in 2011, I was running a project called the Kenya Open Data Initiative. And globally, open data had, caught fire and everyone was opening up their data. And I was doing this at the Ministry of ICT. As the person responsible, I was meeting a lot of people who would say, government doesn't want to open up, government is very closed, why is the Kenyan government, why are African governments not opening up information? And I reminded a few at that point that I was the only person in government with a contract that said anything open data. So to expect that government would magically wake up and, adopt openness when they documented, cases of the risk of opening up. There are documented cases, of course, of the rewards of opening up. But at that time, it was also an unknown. Artificial intelligence, for some of us who've been, practicing computing for many years, we've encountered it and we know what it can do. But then the way the government works is completely different. And this reminds me of times in the 2010s when we were trying to push for open source use within government. And it's very easy for, engineers and computing folks to say, government should run on open source software. But then when you look at what it actually takes to run an open source software, then, the reality becomes something completely different. And very finally, right now, looking at AI, it's a completely new, area of interest for the masses. So at scale, it's completely new. It's not completely new for a lot of people who started off in the 1950s. But then now you can see the companies that are actually producing the AIs are saying they've run their budgets already, and the year is we're only mid-year. That AI is becoming very expensive. The companies that fired people, are saying they regret firing people because now it's not sustainable to run AI systems. Now imagine if government had jumped on the bandwagon, leapfrogged, and actually, started implementing AI systems that they do not fully understand. And but when I say they, I don't mean it in a demeaning way, but a lot of people do not understand AI. So when you don't do that risk assessment to actually understand what are going to be the impacts of using artificial intelligence before you actually implement it at scale. And think about it in this way. Governments have the fast connection that can have the highest impact to the common citizen. So something a government does will have fast impact to a citizen. You change policy in healthcare, it affects 1 million people or more, most likely more than 1 million, right? If the private sector changes something, people can decide not to use it and it's okay. They can have options. So I think those are some of the things that we have to look at in terms of the risks that are involved for government. I am, of course, a champion of artificial intelligence, but I'm also a champion of responsible approaches to artificial intelligence, especially when they affect people at a very large scale.
Thank you very much, Lynette. Violet, please.
I think what I'd like to add from a telecommunication standpoint and to see the work we actually do with government as well. There's a lot in terms of what the government is doing. I think in our context, there is the AI bill, which is currently in place. So it's to see how we can support that by probably inputting into it. Then secondly, there's also been a lot of collaboration. So we know AI is here to stay. So essentially, how can we now leverage off the skill set from the private sector and other entities to be able to now just enrich in that? Then the other aspect is, and from our lens, we also have an entity that we work with. It actually convenes all the telecommunication entities. It's called GSMA. So within that, there are certain workforces that have been put in place that actually govern the ethical use of AI. So for sure, if we actually look at how we can collaborate, the private-public partnerships, and basically inform what the government is doing and also give them some insights in terms of how they can use AI. I think that can actually strengthen and also enforcing policies that can regulate that space so that we continue making sure that it's actually used ethically as well and at scale. Thank you.
Thank you very much. That was a very good question from Loke International, Malawi. And I think in a nutshell, Charles said he doesn't believe government is to blame. But I think we can all agree that government plays a central role in terms of making sure that there is responsible use of AI. And I also liked what Lynette said about AI is new in terms of the adoption by the masses. But AI is not completely new. I remember, this will reveal my age now, but in 1994, taking a computer science class as a first-year student in university, I was asked to write an essay on artificial intelligence. And I will not lie, that was the first time I actually heard about artificial intelligence, and I had to go in the library looking for a book that could tell me what this thing was, which I couldn't find. But suffice to say, I did very well in the essay in the end. Anyway, and also I like this public-private partnership in terms of responsible use, enabling, and I believe also advocacy in terms of how can we ethically adopt AI use, because I think it's got a lot of advantages. But again, we've just been singing praises for AI, I think, so far. Charles mentioned that in the dark side, people are also using AI and it's not for good intention. So this is also something that we need to be thinking about when we're developing solutions. We also need to be thinking, how do we protect people from those other products that will be coming from the dark side? We're already seeing this in some of the social media usage, how young people can be affected negatively because of the power of AI. So this is something I think worth talking about. Lynette wants to come back again.
Yeah, I'm so sorry. In fact, I've remembered an example. Kenya has a social health system called SHA, Shift, Taifa Care. There's many names. And recently there was a a documentary about it and how it's used. It's an AI system, which I actually don't think it is, but for the sake of the argument. And the discrimination that actually comes from what we call algorithmic justice, which is using algorithms to make decisions about people. And how you can see when, especially as Charles said, when you're thinking about the data, if you don't have the right data, you end up discriminating against the people who are in the informal sector. For most of us who are employed, the government can go in and determine and say you earn 50,000 Kenyan shillings every month. These are, your deductions, This is how much you need to pay. For someone in the informal sector who today will make 1,000 shillings, tomorrow make 500, the next day make nothing, the government does not have any data that is consistent enough to be able to feed the algorithm for you to be able to make a really good decision. So this is all to say, in kind of that approach, that then governments really need to be very careful before. So this is not to say government should not deploy. It is that there are so many moving variables that need to be taken into consideration in a very careful manner, because otherwise, something like the social health insurance policy then affects millions of people and will deny people access to healthcare because there's a variable, there's a number that is missing, to feed the formula.
Thank you very much for that. So you'll be pleased now that I will move to my questions, and I will start with Violet. I think you touched on this in the introduction, but if you could just elaborate a little bit more in terms of how the private sector is supporting telehealth and AI adoption in public health care.
Right. Thank you very much for that question. So let me paint a picture in terms of some of the work we've actually done. So a couple of years back, we had this innovation called, it was a collaboration with Huawei, called the Private Sector Health Partnership. So we had a couple of institutions. We had Philips Healthcare and other institutions that are also now in that collaboration. And at that particular point, we're looking at the counties with the highest maternal mortality ratio. So what are the things that we observed? So a county like Lamu has a very high burden when it comes to the maternal mortality ratio. So the question is, how do we now come in and reduce that maternal mortality ratio collaboratively, because we don't work in isolation? So in that regard, we realized that the big cohort of beneficiaries who are actually using healthcare services in Lamu specifically, they're actually facing the distance barrier. So you'd have a mother who's traveling a distance of probably 6 hours when they take when they actually take a ferry, for example, to be able to now traverse from one area to another. And you can imagine this particular mother is probably seeking care. They're just about to deliver a baby, so that is not practical. So the second option for them is probably to take a speedboat, which would likely take them maybe 30 to an hour to actually get there. But it's costly. It'll cost them approximately 3,000 shillings at the time. Does this mother have this kind of financing to be able to do that? That's another challenge. Secondly, assume they're able to get the 3,000 shillings and they are actually able to get to King Fahad, which was now the sub-county hospital that was in Lamu. So when they get there and they actually get another barrier, which is are the specialists existing in that particular area? Third barrier. So what do you do in this particular case? So in this instance, we can leverage technology, and we've seen the use of this in a platform called Daktari Smart. So essentially, this is a private-public partnership, and in this particular case, you actually have the specialists, the pediatricians, who are actually able to now receive care, and they can be able to remotely, give a diagnosis, and someone can actually be able to receive care. In the case of Lamu, I think we had one specialist in Lamu, but then we also collaborated with Mombasa County. So Mombasa County at the time had about 7 specialists at that particular instance. So you can imagine you're able to augment telemedicine, and then this mother can receive care. They don't necessarily have to travel. You just need to probably now equip the medics or the clinicians who are attending to this mother, and they can now be able to now get that remote consultation, and they can be able to render care. So saving that mother the cost that they need to do. The other challenge we also faced in there is assume this mother actually gets to Lamu. Then you happen to find that this mother is expecting twins. And you don't even actually have the tools to even confirm that. So assume this mother, you know at the end of the day that this mother probably has twins, but you didn't have the tools to be able to probe. You can leverage technology, and I think Philips at the time had a tool that could probe, and they could be able to tell that this mother actually has conjoined twins, and then they're able to actually get the right treatment for this particular mother. Now, if you add in the layer of artificial intelligence, we actually have a collaboration with BioNeat, which is actually like an AI symptom checker. So essentially, you are able to actually go to that platform. You can be able to put in your symptoms, and then you can actually be able to tell, theoretically, I think this is the case. However, you probably need to get extra clinical advice to be able to now come up with the right diagnosis. But of course, there's some things that it can actually be able to now, point you to the right direction in as far as what you need to do and to put in place. So there's a lot of things that you can actually be able to do, and leveraging on technology is actually a very good way to really help to make sure that you break those barriers that we are seeing many of Kenyans actually facing. And you can see this is something that can be replicated in different countries. You're seeing different entities doing this in different parts of the world. So telemedicine is here to stay. Artificial intelligence is actually accelerating and alleviate and taking it to the next level. Just making sure that you can render the diagnosis. It can help you now to actually do things like I mentioned, just putting in the inclusivity layer, for example, or even helping you to arrive at a decision faster, in a better way. Thank you.
Thank you very much. I think that's a very good example of telehealth collaboration in practice, and actually links directly to universal health coverage, where people have to have access not to primary health care where they need it, when they need it, and at no cost. You didn't elaborate whether there is a cost, whether reduced or otherwise, to the patient. But yeah, I do like that, and I hope that's going to be scaled up, so it's not one of the pilots that we are talking about that end up not actually being operationalized. So I will jump Dr. Lynette and go to Dr. Charles. So in your introduction, you started talking about successes in Rwanda. So we know that Rwanda has implemented several digital and health innovations. Which approaches do you think have delivered the greatest impact, and why do you think that has worked? And if you can, add why it may not work elsewhere.
All right, so maybe a disclaimer. I think a representative of the government of Rwanda will be better placed to actually answer the question. I'm speaking from really the EMS perspective, like an outsider person. I will start with those intentional system design. So in Rwanda, last year, I think it was in April, they actually launched the National Health Intelligence Center. If you're in Kigali, come and visit. This is the things that is wow, basically. Why? Because I think it's one of the unique countries, both in Africa, but even globally, because some of the stuff that we have in Africa, we're leading best practices. To really have what people believe, really, the National Health Intelligence Center. First, digitalize health records, centralize it to one place, one portal, and then learn from the intelligence that comes from that, which is very awesome. Okay, I think Lynette was talking about, let's not pretend that's always going to be good, because when government also have access to certain level of data, I don't want to talk about that, but there's also a little bit of some issues around, like, are you going to use it responsibly? Are you going to actually monitor citizen fee? But the point I wanted to make was the analytic, the intelligence coming from EMS, I understand, like, and Lynette will also agree. When data is somewhere and then you actually draw inside, then you respond to questions like IFISH is doing to say, IFISH is one of the innovation in Rwanda. In putting together a solution that is really based on primary health care in a rural area. I think Violette was talking about it. Some of us in Nairobi and in Rwanda, we believe that the world is like only in cities. There are people who are invisible, they're not maybe represented in this room, but they experience this kind of challenges that a basic change can actually improve their life, right? So IFISH went on, because of the system in Rwanda, to establish some health facility point, collecting data at that rural area. Be able to receive the information for people and develop trajectory, like having some historical data, health data information, so that when people come to a health care center, depending on the doctor at the time, you don't restart your diagnostic. You have history and intelligence of what they came, the previous visit that they have, and build on that or the symptom that you have, right? Those are kind of very specific things that you will say, but that's not innovation, but it's really around data and infrastructure that you build. Another thing I wanted to say to end up is, when you look at the number of doctors that we train, the number of hospitals in our population, there's no good correlation based of best practices of. So we will take a lot of time to train the doctor in response to our population in terms of having the doctor-to-patient ratio. I think telemedicine is actually proving the point to say, sometimes you don't need to come to the health facility. You can actually connect to the doctor. And the doctor doesn't have to have a queue to actually manage, but talk to people to say, usually the basic information, AI can actually tick the box to say, this is just a malaria, I can tell, and based on your previous visit, this is your history, and I believe that you just need to do this, and then you don't want to waste your time, especially for smallholder farmers in rural area, pregnant women, we need to actually travel for distances. So for me, I want to move the conversation from just the comfort zone that you have in city, we complain a lot, the insurance, to the rural area where people do not have access to the services that we need. Medicine or telehealth makes it possible in terms of access, but also efficiency. That's what I can share from Rwanda. But for me, the takeaway is the National Health Intelligence Center in Rwanda is fancy. So when you come to Kigali, let me know online. It's so fancy that the dashboard, the screen in that room is what you expect in London, where people are using the intelligence to tell you, like, where is Rwanda going in terms of this specific disease? It's there on the platform. And what do you do about it? I think decision makers, they say, now I know. That is the raining season. There's a relationship between climate and health. At this period, this is the decision that I can make because I have that kind of insight, which is for me is quite an eye-opening. That's what I can share. But I'm not sharing this on behalf of the government. I'm sharing this on behalf of MSAs and layer or outside observer. So maybe the government of Rwanda will have a better position to package the message. Thanks.
Yeah, and I believe sometimes it's better to hear things from a neutral point of view than a government spokesperson that might have hidden agendas. But I like an angle you've actually mentioned here, which I didn't cover in my introduction, because my introduction was focusing on having solutions that work best for the patient. But it's also for the practitioner. You know, you mentioned about people not going to the doctor, and the doctor is starting to ask questions, again, that actually they asked on numerous visits before. That works both for the doctor because there is efficiency. We know our doctor-patient ratio is not great. So this is, again, these solutions coming in to provide, you know, sort of like efficiencies that actually limit or actually minimize the time that the doctor is spending asking questions and releasing time for the actual treatment. So I do like that. I will not say any more about this shiny solution in Rwanda, otherwise people will think we've been paid by the government. But in moving forward, a question for Violet. What infrastructure or digital barriers continue to limit scale, particularly in areas that are underserved?
Thank you very much for that. So let me again give another illustration. So when we were rolling out the Lamu telemedicine solution, we actually faced a couple of barriers. So the first barrier was actually connectivity, which, as you know, coming from a telecommunications company, is supposed to be our forte. So in some of the areas, we probably had to innovate in an area like Mandera, or in other spaces, you actually had to go to the remote parts of the country. And obviously, the population in that area is quite sparse. So obviously, you likely will not have enough base stations that are covering that area. So a base station is basically what you use, the booster that you use to submit or transmit a signal, so that you can get optimal coverage. So when that was happening, we actually had to put a concerted effort to see how do we ensure that the areas are covered so that we can actually be able to have a robust solution. So coverage is definitely one of the barriers that you'd obviously face. But as a telecommunications company, and also with the support of government, there's something that we call the Universal Service Fund. So essentially what this does is that every telecommunications company is required to set aside some funds that augments the government's effort to ensure that those areas that are sparsely populated actually can get connectivity. Secondly, it is important to actually see, the investments that you do put in as far as technology are concerned. They're actually, low latency. So for example, you look at technologies that can actually operate with minimal data requirements. So in the case of the telemedicine solution that I mentioned, just looking at seeing how you can actually have cameras that don't consume a lot of data, and also now putting in place technologies that can work with what connectivity options are there. So in our case, it was now looking at, can we use 3G, for example, which was now obviously better spread as opposed to what we're seeing right now. There's 4G, there's 5G. But obviously, it's not every area that will actually have 4G and 5G. So from a telecommunication standpoint, it's important to see how can you put in place infrastructure that can even be able to support, in as much as now the connectivity options can be a barrier. And in addition to that, also looking at options, offline options that can actually assist to ensure that even as that care is being sought, you can still be able to continue rendering care, and probably at a later stage, it can be able to synchronize that data. So those are some of the things that we're actually being able to put in place. But obviously, we keep learning. We keep looking at what are the things that we can continue to improve on, so that we essentially make sure that no one is actually left behind. And now we are seeing a lot of adoption of cloud storage. So what this then does is that it actually allows you to be able to leverage on technology and leverage on the best of it, but in optimal situations. Thank you.
Thank you very much. Good to see that you've continued with the inclusiveness theme. And again, I hope you will be going further in terms of, because some of these solutions need people to have like smartphones. And at the moment, smartphones may not be, even people living in Nairobi, working in Nairobi, might not be able to afford them. So it's how basic can you make these solutions become so that even Mama Mboga somewhere is able to access this and not actually suffer poor health simply because technology has left her behind. But thank you very much for that. So we are running out of time, but I just want to give our audience another opportunity to ask a question. So if anyone has a question based on what has been said here, please. Yes.
Thank you very much for the panel. I just want to know if we need to advance AI before connecting our data systems, or if it's the other way around, or if they go hand in hand. I'm asking this because there are issues of fragmented data systems. So what can we start with? Thank you.
Very good question. As I think the old saying, the old African proverb says, which it isn't actually, rubbish in, rubbish out. Our panel, that's the question. Lynette.
Yeah, thanks for the question. For me, it can be done in parallel. One does not have to precede the other. Because you can spend too much time preparing and the AI passes you, and you can spend too much time on this other end that you feel like, many years ago, we used to have this joke of small data, big data. And people used to say, we don't have big data, so where do we start? And I say, start with the small data. I wanted to touch on, the fragmentation that you have mentioned of our data systems as well. In 2017-18, I was involved in a project for Kenyans. They would know the managed equipment services. It was a partnership between the government, General Electric, that GE, 7Cs, and my company, Data Science Limited. We were providing the analytics part. And the idea was to connect the entire country and all the hospitals and, make these nice dashboards that I guess now Rwanda got, so that at any given time, people know. Because when you connect that, it's not just about the patient, it's also about planning. Because the government would know or would see that we are getting more oncological services done in a particular region and start to ask why. We are starting to see more cholera type cases showing up in the system from one region and start to ask why. So that even at the doctor level, at the service level, when someone presents with some kinds of symptoms, given the level of exposure of your region, you're also able to conclude a bit faster before you take a patient here and there. So all those things can be done in parallel. The globe is not going to stop to wait for African countries to get their act together, and African countries really need to start investing a lot. When I mentioned very finally open data, one of the things I was proud of that we used to do with the Kenya Open Data System is you could go on the platform and actually see patient, within hospitals, patient-doctor ratios, patient-nurse ratios, patient-bed ratios. You could even tell what services are offered at what hospitals. So for instance, you could, if I live next to a hospital, I could go into the system and see that that hospital does not offer orthopedic services, for example. So if I break my leg, I could go to that hospital, but I'd be wasting time. I would rather spend more time going to a different hospital that I'm sure has those services. So getting that data in place and getting those systems in place is really important, and we cannot wait for one to be done before the next.
Thank you very much. We are running out of time, and there's a question that I think all of you can answer. So that would be your last but one question. So this is, and it's unfair, I think this was meant for Charles, but I'm sure you others can answer it as well. How can AI be adopted responsibly while maintaining equity, ethics, and trust?
Through partnership. I think it's important for us to develop very trusted partnership. And I will end by saying the 4 pillars are correlated. Again, I don't believe that we will develop AI the way we want to do it if we don't take issue of data seriously. If we don't take issues of compute seriously. Okay? I was in one of the panel before where people are talking about who owns our data that you're running your model on, right? The talent, let's face it, we do not still have a lot of computer science graduate in our university to our need. We cannot just overnight believe that we're going to develop the AI engineer that we need. We need to develop talent intentionally. Okay, talent does not necessarily mean technical talent. Even policymakers need to understand what we're talking about. The last thing is actually the enabling environment. So in that project that I mentioned, I don't see a lot of investment in Africa in terms of AI. Okay, as compared to the rest of the world, right? People are talking about half a trillion US dollar for those kind of data centers. So for me, I come back to say it's partnership. Government alone cannot do that. It's private sector. The private sector is here. Private sector and institution. NGOs, youth-led innovation, and the organization come on board. It's all of us together for us to make it a response. It's not one single organization or one component of society that can do that. But let's face those 4 pillars because I think they are interrelated. Just for a joke, there was an AI tool that was developed in the US and trying to detect people's gender. People who wrote the model were American AI engineers. So for them, the definition of woman based on the image was not my mother or my grandmother. And then we ran the model in Africa. most of our mothers and sisters were male. Why? The data definition was not really in our context. That's what I'm talking about. We need to take talent development very, very seriously. So, yes, I will stop there, but that's what I believe.
Thank you very much. Lynette, do you have anything to add to that?
Yes, I'll latch on to one point that you have said, and anyone who's heard me speak knows that I end everything I say with my one rallying call, and it's been for the last 2 years or 3 years. We must raise scientists as Africans. We must raise scientists. And I say that to say, just to what Charles is saying, today the person who's developing the model sits somewhere in San Francisco, very far away from you, and it's honestly very unfair to expect that they would understand what our ethics are, they would understand what equality means for us, they would understand what AI means for us, and they would understand what our women look like as well. But if we can develop those systems, and for most of us it's already too late, if our children can sit in the classes that understand these skills and learn these skills and develop these models, then Africa, we will still continue to be misrepresented for the next few years. But until we get a critical mass of our children, of African children, studying sciences and developing these models, contributing to these models, contributing to these policies, we'll still be left behind.
Thank you. Anything to add briefly?
Very briefly, I'd just like to talk about privacy by design. So making sure that you actually put an environment that at the focal point is privacy by design. So in our organization, it's all about just putting in the measures to secure that data, whatever it is that you're actually putting in place is in a secure environment. And you've actually been able to see organizations have their own AI models, which they train, and it's in a controlled environment. So if you put in the security measures, mechanics, privacy by design is at the heart, you should be in a good place. And to the point of talent, I think I also need to reiterate that. Let's build the future scientists. Let's have these data scientists. Our children are coding, so let's take them to the next level, and they'll be our advocates for the future. Thank you.
Thank you very much. Let's give them a round of applause, please. So just in summary, it's been a long, fruitful discussion, and I've taken quite a lot from it myself, and I'm sure and hope that you have too. So if I just take 5 key points that we've had from here, is that AI has real potential in African healthcare systems, but context matters. So we can't apply like one solution in one area to another. We need to be considering sort of like the key dynamics. Infrastructure remains a major barrier to take up, so there is need for investment in that. I think there's been an agreement in this discussion that government must lead responsibly, not just regulate. So it has to be a key stakeholder. Data quality and algorithmic bias are critical risks to some of the progress that we're making. So whatever we do, we need to be making sure that the data that we are putting in our models actually represents the people who we are building those solutions for. But also, I think Lynette covered that algorithmic bias that, again, we have to watch out for. And then finally, success requires talent, trust, and good, fruitful partnership. It has to be, I think, people have to see the benefit in it. I think we have to accept that private sector is not a charitable organization. So they will always want to see what's in it for them. But of course, there's also that social responsibility that they hold. And genuinely, they will want to do something. So with that, I would like to just thank our panel again, Dr. Charles, Dr. Lynette, and for today, Dr. Violet. Please, let's give them again a big, loud applause. I just also want to thank Sylvia and John, who have helped us with the sign language today. And of course, the people behind the scenes who have made sure that the sound did not drop at any moment. So we can clap for them as well. So with this, I can happily say, panelists, please go back to your seats. But the trend has been, don't go back to your seats, there have been photos. So let's have photos as well. Yeah, and then, thank you very much. Everyone else, feel free to go for lunch, but grab our panelists if you have a question that you've not been able to ask. Thank you very much. Clap hands for yourselves as well, please. Thank you.